Yeah, of course. So I'm George. I'm the training engagement lead for the Leeds Community Gambling Service. I'll go into a little bit more about what we do as a service in a little bit. But first, I'm going to hand over to Kieren Smith, if he's in here. I believe he is, just to tell a little bit about his story around gambling and suicidality as well. Kieren, are you there?
I am, yeah.
Yeah.
Can you hear me all right?
Yeah, we can hear you. Do you want to start, Kieren, and then I'll come in after you, and I've got a few statistics and a little bit of presentation to do.
Yeah, so I'll just touch a little bit on lived experience with gambling arms, and as a result, the impact on my mental health and the thoughts it led me to eventually. So my gambling journey really started around 8 years old, and it started at the local seaside, where I would play the fruit machines quite a lot of the time that I was there, and it became apparent to to what should have been to me. I know I was young, but if I look back now, it was apparent then that I had a developing addiction to gambling, because it wasn't just the playing of the fruit machines, it was the bright lights, the warmth, and the safe place that an arcade offered, that I enjoyed. It wasn't just the actual physically playing the machine and winning or losing money. And what would happen is I would see going and doing other activities at the seaside as a inconvenience. I would much rather not go to the beach, not go and play football, not do other seaside activities, and much rather just spend my time locked in an arcade. So over time, this is around 8 years old. I would say by the age of 10, I was fully fledged gambling addict, in terms of what I could access and what I could gamble on. And gambling was so normalised around me, even back then, and it's worse now. But there was a lack of education back then, and as I developed, as I got older, I would then start to look at other forms of gambling, other ways, and as I began to ask people to put football bets on for me, I was sort of lured into a false sense of, if you like, skill, because I thought I know a lot about football, I've got a good chance of winning. And really, it's not really the case. But I would literally beg people to put bets on for me because I wasn't old enough. And maybe due to a lack of education or whatever reasons they had, they would often give in to me and put the bets on.
Brilliant, Kieren. Thank you so much for that. Are you
I think
still there? Or is it
Kieren might have muted himself.
mute yourself, Kieren.
I'll try and get him off.
Is that?
We can hear you again now, Kieren. Thank you.
Done then, no problem.
So, shall I carry on or? Yeah.
Yeah, go for it, mate.
I'm not sure what you caught, but I was just saying that I would literally beg people to put money on football bets for me, and what that gave me is a different form of gambling, but also an opportunity to win slightly more than, in a financial sense, what you would win on a fruit machine, with a bet on a football. And that became appealing, and that's a familiar pattern in my story, because as I get a little bit older and I'm earning my own money, I then start to look at other ways of gambling. And I'd always wanted to go in a bookmaker's. It was like the pinnacle, really, of gambling for me. I'd often stand outside the paper shop and look at adults inside the bookmakers and see that there was having fun and there was in a warm environment and amongst friends, and that appealed, particularly when you're having a bit of a bad day at home or at school, getting bullied. It's like a safe place that it looks. And so when I became 18, I was obviously allowed to legally go into bookmakers, and that was really when things started to turn. As I've just mentioned, it opened up a new appeal to me in terms of what you can win, because from winning £5 as a maximum on fruit machines, I could now win £500. And it's not all about finances, but that became very appealing at such a young age. The fact that I could win £500 every 20 or 30 seconds, but also I could stake up to £100 at that stage as well. So I became instantly addicted to the roulette machines, the fixed odds betting terminals. And it began to be a stage where every payday that I got my money, I couldn't go home without calling at the bookmakers, and more often than not losing every penny. This led to a lot of problems in my marriage, relationship, where I lived, things like that, because the knock-on effect is, it's torture for family and for your wife or your partner, because they never know how they can plan the money. They can never do anything regards financially, because they don't know that money is going to come in, because I would often just lose it on the way home. And so the impact on that, both for the partners, the affected others, and the family having to see the consequences, which would be not just financial for me, but I would often self-harm. I'd often isolate myself away. And a lot of that was feeling so guilty about what I'd done, and, the position that I'd often leave ourselves with. But then next week would come around and I'd be planning all week how I can do it all again. And that was, I was well and truly hooked, line and sinker, and gambling had got me. So when I start to become more and more in debt, financially in debt, I'm starting to then get more and more desperate. So I want to be able to win more money. And then I started to look at online gambling. And that's because whereas it was capped in the bookmakers at, £500, online offered an opportunity to win thousands. And because I'd got, debts building up, it became really appealing. The fact is, what became appealing is not, in hindsight, not the fact that I could win thousands. It's actually that I could quickly, very quickly, more quickly than ever, destroy everything that I've got in the space of 2 minutes, going into my phone and launching a website. And that's for me when things took an all different turn. And just the simple easiness of being able to get your phone out of your pocket, go and put yourself in a dark room and gamble until your heart's content or until you've lost it all, became my life. It really did. And it led to some horrendous financial situations, but also mental health wise, I was in an utter mess, really. I was consumed by gambling. I was consumed by the losses. I was consumed by the need to chase those losses, or so I thought. And even when I would win, it would never be enough. And slowly but surely, my whole world was falling apart around me, and I was the one causing it. I've likened it before to, I know it sounds crazy, but having pins, drawing pins in your trainers, and still wanting to go out running every day in them. It was literally, you're going to cause utter pain and heartache for you and people around you, and you still go and do it. And it's an awful place to be mentally, physically as well. The physical symptoms of all the anxiety, I would go red hot, flushed in a bookmakers or when I was gambling, palpitations, and then obviously the financial impact as well, which did lead to me and my wife losing our first home. we became homeless. You know, we got evicted. We was living on the streets, barring the fact that I was driving around a car illegally, and I was just sleeping in the car. And then I was turning to drink because I just couldn't cope with what I was doing, because I saw no way out of this addiction, because my whole world had become reliant on whether I won or lost. But in reality, I was losing everything. And it wasn't too long then before, in September of 2018, I took an overdose. And I look back now, and did I want to die? No. Did I want all this to stop? Yeah. Did I want to stop causing this pain to others? Yeah. I didn't succeed, obviously, in stopping, you know, ending my life. Fortunately, and I look back now, and you know, it was one hell of a cry for help. I had self-harmed overnight. I had lost all my wages overnight, and I just wanted it to stop. After that, I was released. I was mentally unwell for quite some time, but I still carried on gambling, unbelievably. Out of desperation, really, that we was in such a financial mess that I hoped one big win would sort everything out. Of course, that big win didn't come. And then we lead on to where I'm at December 2018, 27th of December 18. I attended a local Gamblers Anonymous meeting, having also sought help from GamCare over the phone. And I knew that it was one of three things that was going to happen. I was either going to go to prison because I was now involved in criminal activity to fund my gambling. I was going to, unfortunately, lose my life through suicide because this had to stop, or I was going to actually stop gambling, and I knew it had to be now or never. And fortunately, with the right advice, the right tools, the right support network, and that, you know, that didn't just include going to a meeting, that was telephone support as well. I was able to put the right things in place around me to break that cycle, that chasing losses, that one hope of one big win, that devastating impact on family, that self-harm, that suicidal thoughts. I was able to break that cycle. And fortunately, since the 27th of December 2018, I am gamble free, and I still am to this day. And now, you know, things are not 100% rosy. You know, the impact of what I did financially has ruined our credit rating. We're unable to get a mortgage. We're unable to get even a rented accommodation. A lot of landlords won't touch us. You know, we struggle to even get a mobile phone on contract. It's made my daughter's start to life, which is an incredible thing that happened to us in 2020, a difficult one in that I can't provide her the home and the safety that I would have been able to had I not ruined our you know, financial position and credit rating and things. That's the impact of what gambling addiction can do, whether it's to yourself or someone you know, your friends, your family. And you know, it's not just when you stop, everything's fine. There is long-lasting consequences, and that's why I urge anyone who is struggling with gambling, or friends and family, let's not normalize gambling. Let's actually normalize speaking out and getting help if you're experiencing gambling harms, because as I mentioned, it has a massive impact on your mental health and mental health of people around us, and it can, you know, it can take your life. It can take people around you. It led to my wife having a mental, you know, a breakdown and ending up in a mental health hospital. And that's what I did. So it's, you know, I urge anyone, and if anyone's struggling, anyone who knows anyone struggling. Encourage talking about gambling. Encourage it. You know, it's not this isolated taboo that it has been in the past, and we can speak, and there is help out there, various help out there, and I think we can all help each other in that. I certainly try to do in my work now, going into companies and you know, schools and things. So yeah, that's my story. I hope I haven't rambled on too long, but yeah, thank you.
Thank you, Kieren. Honestly, that's it really humanizes what I'm going to come on to next. Sadly, the story that Kieren spoke about is a story that we hear all too often, especially when it comes to the things like it being a means to the end. People put themselves under that much financial difficulty that they see the only way out is to continue gambling. But yeah, I'm going to move on to just a little bit about our service and what we do over at Leeds Community Gambling Service and GamCare, and then and just some statistics to show you as well. Can we all see that? Can we see it? Give me a nod, someone.
Yes.
Brilliant.
Yes, we can.
Thank you very much. So yeah, so we're Leeds Community Gambling Service. So we're part of GamCare. So GamCare is a national charity that is a leading provider of gambling support and education in the UK. We're in partnership with NECA, who run our treatment service, and Leeds City Council as well. So just a little bit about us as a service. So I don't know if anyone's who's from Leeds and who knows it, but the Victoria Gate Casino, the main casino in Leeds, when that first opened, or sorry, should I say when it got its license, part of its license agreement was it had to fund a study into the effects of gambling in Leeds and how harmful it was in Leeds. What that study found, it was done by Leeds Beckett University. It's online if you want to find it. It's just called the Beckett study. It found that there was up to 30,000 gamblers at risk from harm. 30,000 at-risk gamblers in Leeds. That's double the national average. So we knew there were an issue in Leeds, and then from there in 2019, us, GamCare, NECA, and Leeds City Council created a partnership, and Leeds Community Gambling Service was founded. Some of the things that we offer at Leeds Community Gambling Service, so we do community outreach, which is going into communities, talking to members of the public. You might see us in shopping centres and things like that, and just trying to raise the profile of our services and just gambling harm in general. We have a criminal justice lead, so that's my position as well. So I work, do a lot of work with HMP Leeds. We're hoping to expand that even more soon and do a lot of work with probation. We do some work with liaison diversion already, and so on. So want to cover the entire criminal justice system basically. Engagement and training. So this is sort of this kind of thing where I reach out to individual services. And we have a training package which is free. A little plug there. We have a training package that's free, just to try and raise the profile around our service and gambling related harm. We'll look at things like I'll explain more of that later if we get a chance. We have free treatment, so everything that we offer is free. We can offer treatment for either face-to-face, over the phone, online. We're based in hubs across Leeds. So we will. So we'll be able to. Thanks, putting the study in. We'll be able to we'll be able to go to the more better location for you. And we have the young person, young adult service. So this part of the big deal team going into universities, we're going into schools, and we're just speaking to whether it's students, teachers, young person sport teams, all of that thing, and just trying to raise the profile again around young people's gambling. So I'm just going to go through some of the statistics that we've got. So the first few slides are around statistics that we've actually got at GamCare. So these are people that have come into service with us and around mental health issues and suicidality. So the first one, just a little bit how we've gathered this information. So when an individual contacts our service via the helpline or other means, We obviously do a form of risk assessment when health and mental health issues is disclosed. These figures are taken from the last financial year, so sort of last April to this April. So it shows that so where it says other location, that's the rest of the country. So high risk individuals, there's 122 for the rest of the country with high risk to mental health, and then 1,597 to medium risk, and then just in the Yorkshire and Humber we have 12 people, and the medium 160 people. That's 9.1% of the total medium risk and 9% of the total high risk individuals, and that's just in the Yorkshire and Humber region. I've got a little bit of a map here. Sorry, some of the actions that we're taking. So obviously we inform management. All the stuff that we gather goes to what we work with training in terms of internal training our staff and things like that. Ways live primary care services, GPs, all that kind of thing. And then obviously we'll look at for the individuals, we'll signpost to other mental health crisis points where appropriate, whether it's Samaritans or NHS, all that kind of thing. So on the map, so as you can see, the majority of the calls that we get for for mental health issues is West Yorkshire. Obviously there's a little bit down there in the south. You can see how it's the more deprived areas there. Obviously we know Leeds, Bradford, Huddersfield is pretty deprived, and you can see, but there's no reason at all why that kind of thing isn't going on in other areas. What we have got in Leeds is because we have got a localised treatment service where the only place apart from London that does have one. So this could show that we're just not capturing it in other places as well. So these are all the individual cases for Yorkshire and Humber. Obviously, like I said, you can see there how it's more prevalent in the West Yorkshire region. Next, we're going to go on to the risk of suicide. So again, similar to before, another same sort of method of collection of the data. This is from last April to April. Last financial year, so it shows that 7.4% of the median risk of the suicide is in Yorkshire and Humber, and 12.4% of the total high risk. So that's a massive number. That 12.4% there. The whole people that come through our service is come through GamCare as a whole is in Yorkshire and Humber and is in a risk, medium risk or high risk of suicide. Again, some of the actions taken, we look at it if it is a high risk, if it is crisis point at the time of call. We look at other, whether it's 111, 999, again, contact primary care networks. Make sure safety plans are in place. Obviously, following all of this, we devise risk assessments, and that's where this data is taken from. It's taken from the risk assessments. And then obviously when if these come through, we will be prompting them to come into service full time to speak to one of our practitioners in a more detailed way about how we can help them and how we can help them with their gambling issues. Just a really quick one again. Obviously there's a few less dots on there because there is a few less people with suicidality rather than mental health issues, but it doesn't take away the fact that the majority of people that are coming into our service from Yorkshire and Humber are in the West Yorkshire region as well. Just to again to echo what I said before, there's no reason that this can't be the same in other places. It's not seen as that because people aren't asking the questions, the screening questions aren't getting asked. They haven't got localised treatment services where we have in Leeds. Just on this last one. Oh no, sorry, a few more. So these are from studies that Public Health England have done. This is the evidence review from 2021. It was the first gambling related harms that were published in 2021. It's one of the first of its kind in England, and it just goes over some of the harms in regards to gambling. So, two quantitative studies reported that deaths from suicide were significantly higher among adults with gambling disorder compared to the general adult population. It's been suggested that gambling may trigger suicidal events in people who have a history of suicide ideation. So people who already have a history and then turn to gambling or already gamble are more likely to take their own life or attempt to take their own life. The link between gambling and suicide and self-harm was supported by qualitative studies. Again, I will put the links to these in the chat. And the cost to society from gambling related harms. So an estimated cost of suicide is £619.2 million based on the wider cost of estimated 609 suicides per year associated with problem gambling. Obviously, it's a massive number of estimated suicides because of gambling, but also a massive cost as well to the government. But obviously, that's besides the point. We're not here to talk about the money aspect of it. We talk about the individuals that are taking their own lives. One more here as well. So this is from the Leeds Suicide Audit. So bear in mind, this is an old suicide audit. So it is getting regulated a lot more now. It is getting checked up on a lot more now, and they are screening for gambling after suicides a lot more. In this time, it was very rarely looked at. It was still a relatively new field of study in regards to how much was coming out. This is when people were gathering the evidence for how many suicides there are due to gambling. So in Leeds, there was 205 suicides by residents in 2014. In 2016, only 6% of the 205. 2% had evidence of problematic gambling. But what we need to look at as well is how that's looked at. So in terms of coroner reports and things like that, we all know that they do toxology. They will look at toxology. They will look at things like that. If there's alcohol in there, then they will look at alcohol straight away and they will put that down to a cause of death. But will they, cause of one of the factors towards suicide, but would they look at gambling in regards to that as well? Again, that's only recently starting to happen in a more comprehensive way, and that's due to a lot of media coverage. If you just do a quick Google regarding something that happened earlier this year in regards to coroners, you'll see that. The next one, so I know that's all a lot of numbers. So the next slide I've got is from a study in 2019, and this really puts it into perspective in regards, because don't forget, there are suicides, but there's also the people who attempt to take their own life because of gambling. So this one we've got, so this was a study from 2019. 37% of men 16 to 24 who attempted suicide were problem gamblers, compared to 3.6% of who had no suicide thoughts or attempt. And then it's same age group, 14.5% of women, compared to 2% who had no suicide thoughts or attempts. So how this data was taken, they took a sample of around 3,500 people across the UK. They asked those individuals who had attempted to take their own life. From there, they narrowed that down. They asked everyone did a Pgsi score, which is how we measure someone's how badly someone is gambling and how much to do it and how harmful it could be to them. 37% of the people that had attempted suicide were on that quite high on that scale. So this is it. So yeah, so they're compared. So just 38 of the other men who had not attempted suicide or had suicidal thoughts were not problem gamblers compared to the other side, which is around 62. I can circulate the slides after, of course I can. That's the end of me. That's the end of my slides, but I know I've got a couple of minutes left during the break. I'll remain here in the break, and if anyone does have any questions, feel free to ask me. I'll hang around through that.